Dr. Gulati doing his daily rounds.
Hi Elliot, how are you doing?
Okay.
His patient is 14-year-old Elliot Knott from Dorchester, who injured his back while ice skating and is now recovering after surgery.
Okay, that's pretty good. I remember when you came you were like that, weren't you?
Yeah.
Absolutely, yeah. It's good. Let's see you walk.
Doctor and patient are pretty happy with the progress.
You removed your stitches today and that looks quite good, doesn't it? The
Yeah.
wound's quite healed now.
The view from the window of his private room isn't verdant Dorset, but the suburbs of Delhi, where Elliot travelled with his mother after being told they'd have to wait for months for NHS treatment in the UK.
Well, we just kept phoning them up to try and get appointments, and you just felt like you were being fobbed off all the time, really.
It's terrible, really, because I would have probably been like held behind at school a year because I wouldn't have been able to gone in. And I don't know, like a year is a really long time to wait for an operation.
Apollo is India's leading private hospital group, and the cost of treatment here, including airfares, is less than a quarter of the price of private care in the UK.
Great, really, because you can get them to do anything. I even had a McDonald's the other day.
It's fascinating.
Look at these, look. I mean, it was scary still, the thought of coming to India. You know, I must admit, the couple of nights before we came, we didn't really sleep that well.
Don't knock it.
No, don't knock it.
For Karen Holman, a special constable with the Bognor Police, it's time for a bit of sightseeing with her husband after a cartilage operation on her knee at the Apollo.
I said to John, let's just go for it. I'd rather travel 8 hours on a plane and actually get someone to look at my knee and deal with it than actually stay at home waiting. Yes, it is cheaper, but that's not the issue. The issue is I've had the operation and I can now get on with my life.
Karen and Elliot were among 4 British health tourists being treated at the Apollo during our visit. And the man who represents the hospital in the UK says the numbers are growing rapidly.
Initially we were getting maybe 20 or so inquiries a month. Now we're getting in excess of 60 to 70 inquiries a day.
It's being made possible by the return to India of doctors like Yash Gulati, who operated on both Karen and Elliot, whose condition was the more complicated.
I remember when he came, he was all bent up. He could not stand, he could not walk because of this slip and the fact that the nerves had been stretched so much. And now he's very comfortable, walking around nicely.
He's UK trained at Liverpool University and worked extensively in the NHS, as have most of the top doctors here. They feel comfortable with British patients, and the British are familiar with Indian doctors, who've been attracted back to India by opportunities that never existed before, equipment as good as anywhere else in the world.
But now everything is available here. Things have, changed so much, and it's on the up. So if you have good opportunities coming here, why would people not come back? I think it is logical. It appeals to common sense.